So without further ado, I invite Miss Ishtar to have the floor.
Hi everybody. So as my esteemed colleague said, it is a very challenging session after lunch. So I hope I won't bore you. Maybe I can, yes. Is that okay? Okay, excellent. So first of all, thank you for having me. I'm really excited to be here. This is my first, I hope not my last, Malaysian National Cancer Congress. I have to, as you all heard, I have to confess that I'm not a doctor, I'm not a clinician. I went to law school, very boring, very different, but life somehow took me to what I think is my calling, which is childhood cancer. And well, it takes all sorts. We all have a space, we all have a role in this space. So my first question to you would be, what do you think a child needs to grow well? Like, I know it's a very basic question, but if you think about it, you know, we obviously need to care about the child's health, about feeding it, about housing it, but what else? Because those are very tangible, but wouldn't you say that there's a lot more? We all understand that when we have children, they need love, they need care, they need play, they need a childhood, they need a family. Well, the saying goes, it takes a village, right? Mm-hmm. And it does take a village to raise a child. And we all understand the power and the essentialness of children within the community and for the future well-being of our society. So I think we as the cancer community have been short-sighted because for a long time we've very much focused on keeping the children alive. And we're doing this much and much better every year. So to give you an example, in Spain, we are currently at over 80% survival rate, which is fantastic. However, we are not, and there's a huge disparity. So in some countries it's as low as 30%, and that's a shame. And that is, there is a universal responsibility to change that. And we can all do so much more to change that because we know what works and we have the tools, and that is not a conversation for this moment, but I think it's something that we all should keep in mind, that it falls on everybody's shoulders. If we can do something, we should do something. But it goes to say that I know, I believe, and I have proof that psychosocial support goes above and beyond, and that there are new standards of care that we have proven are more effective by so many metrics. Now, this is Paul Newman. Do you recognize him? Do you know who he is? The handsomest man in the world. And this is not why he's here, although that's a good enough reason. But Paul Newman created an organization called Serious Fun Children's Network. And he had been at camp when he was young, and he must have been a rebellious young man. And camp, he said, was very important for him. And so a friend of his had a son who had cancer, and Paul Newman went to visit and realized that the hospital was a really scary place. The child was just being treated with adults. It was very dark and gloomy. And so he decided to create what for him was the best moment of his life, a camp. And a camp for seriously ill children. And the motto of this camp was, we take our fun seriously. Because of course, why not? And so this camp has grown into a family of 30 camps all over the world that treat seriously ill children. Now these are amazing, amazing, amazing camps, like top level. Any child would be lucky to attend these camps. But what he said is, I think, very important for us to keep in mind. There really is no such thing as a sick child. There are children who happen to be sick. Now, they still deserve a chance at childhood. And we have to ensure that. Now, I don't know if you've had a chance to read it. This is just a testimony from one of the families whose children we have sent to camp, because at Aladina, we ensure that about 250 children, completely free of charge, have the opportunity of attending one of these camps every year. So from now on, other than admiring his beauty, you can admire his amazing heart, because he has, his foundation, his charity has donated over $600 million, not only to the camps, but for other charitable endeavors. Okay, so this is the data. 400,000 children diagnosed with cancer worldwide. And the survival has drastically increased from the 60s. However, still not doing such a good job worldwide. Now, as we discussed, survival does not equal quality of life, and for too long we've been focused entirely on the recovery rates and less on the quality of life during the disease. And I want to go even further. I want to talk about survivors. Survivors are forgotten, mainly forgotten. There isn't a lot about survivors to be spoken. It's, a cause for celebration. How many of us have seen, these videos like, we ring the bell, hospital stays over. What happens afterwards? What happens to all of these limitations, physical, psychological, that go on afterwards? I think the next challenge is going to be how to help survivors, especially if we are achieving these high rates of survival, which are fantastic, but at what cost? And how do we support them moving on with their lives? Okay, so this is so you can have a little fun. This is baby me. And Paco, who is my good friend and founder of Aladina, the president of Aladina. And Aladina comes from Aladdin, so that's why, we dressed him as Aladdin for a photo shoot a long time ago. And so just to give you a very quick background, Paco he came from a very prominent family, and he was very fortunate, and at some point in his life he said, well, I want to help. And he asked a friend for a referral. How can I be of service? And this friend sent him to work with children with cancer, a volunteer, like our wonderful volunteer here. And so he landed in this unit and started talking to the children, to the families, and then one afternoon a week became 2, and then they became 4, and then they became 5, and he started going every day. And 4 years later, he said, well, I need to give this some shape and some structure, and this needs to survive me, and I'm going to create my organization. And so 19 years later, we are the main childhood cancer organization in Spain. But when we started, it was just 3 of us in a room with a lot of energy, a lot of willingness, and we have made many mistakes along the way and learned a lot. So now, as mentioned previously, 22 hospitals that we work in. We help over 2,000 kids, and this is just a quick highlight of what we do. Psychological emotional support, therapeutic recreation, dog therapies, really cool. Very reluctant hospitals, but now they're accepting it, and it's only going to grow bigger and bigger because it works. Physical exercise, so important. Children go from playing and running around and being active to being kind of like stuck to a hospital bed, and nobody considers that this is it's counterintuitive and it's bad for their health, frankly. And now there's so much data, so many research projects that have, without a shadow of a doubt, demonstrated that it's essential to have physical exercise, especially catered for these children. We support the whole family, obviously, and then we provide improvement of infrastructures for public hospitals. Now, the last one gets all the glory because we make major projects for big hospitals. So we're just finishing up one that's about 7.5 million euros for a public hospital. That is a big number, and it's got a lot of impact because the spaces where these kids are treated are very important space. You know, it can decrease stress, getting light, having a place where to sleep, where to rest, that's essential. But I don't think it's the star of the show. Okay, so one of the major things, if we have to go back to the scientific evidence, which we must, because psychosocial support, everybody understands that it's so important, but it's not as easily measurable as some other markers. So for doctors, I understand in the scientific community, everything is data-driven, and thankfully I'm in the fringes of the scientific community, so I can take some licenses, but it's hard to quantify the level of improvement in terms of happiness or decreased levels of stress, and sometimes just that gets kind of forgotten. It seems that as though it's less important, and although we are making huge efforts to provide data and to be as scientific as we can, there is a level of it that is just lost in translation, and you have to be there and you have to live it, and you have to get a hug from those families, and you have to listen to them and really hear that your time with them has been life-changing and transforming, and that just by being next to them and hearing what they have to say, you are helping, despite the frustration that not being able to maybe do more or help more gives you. Okay, so these are improvement in treatment adherence, reduction of side effects, consistent evidence of family quality of life improvement, whatever variable. So the 4 pillars of well-being, psychological and emotional support, star of the show, clearly. I mean, we all understand we need, most of us would need therapy. In an ideal world, well, these children and families need specialists who can provide the tools they need to face every stage of the disease. This is long, it's hard, it's heartbreaking, and professionals can make it so much easier. We do individual therapy, we also do support groups, and we work a lot with the whole family. We treat siblings. Siblings are very, very often forgotten. It's such a shame. This is a bomb, childhood cancer is a bomb that explodes and affects the whole family. Siblings should not be forgotten. And then, there's many other ways of therapy. So we act through art, play. There's many, many ways you can help children express themselves and move forward better. So, family support, obviously. If you don't care for the caregiver, there's no way the child's going to be fine. And one of the most common things we encounter is you go into a room, and this changes between children and teenagers. So you go into a room and then you'll ask the teenagers, "So how are you?" It's like, fine, I'm doing well. And then you ask, you see the mother next to the bed, and it's like, we're all doing great. And then when the mother goes out, the mother starts crying. And then when the teenagers, by himself or herself, they'll kind of crumble down a little and say, well, if I'm honest, I'm not doing so well, because they love each other, they're protecting each other. But particularly parents they are tremendously brave, and they carry the burden, because in the case of children have this amazing capacity to just live every day fully and kind of forget what's going on. And parents never forget, unfortunately. So parents need a lot of help. Well, as you can read, from 25 to 30% of parents develop PTSD during treatment, and then this disease is long, and there's a lot of recurrence. So, siblings and family intervention. What we do is we work a lot. We organize a lot of activities for families. So we try to bring fun to the whole family unit. We organize activities just for the kids. We include a lot of the siblings. Then we organize only activities for the siblings, and then things for the whole family to do together. Because these families have not functioned as a family unit sometimes for a very long time. And they just need to de-stress and not talk about the disease and have fun. So socialization, key. We all need our friends, we need our community, we need to feel like we're part of something. And very, very often, there is such a disconnect from the moment they get a diagnosis from their, previous life to this one. They have a lot of trouble going back to school, continuing friendships, and that's really sad. There's a lot of stigma, less and less, but in some communities still there is. And they face, this happens also to families. Like, it seems as though it's hard to talk to everybody at the very beginning, show support, but then it's hard to keep up, and it's hard to know what's going on and to continue showing up for them, so they feel very lonely. And generating these spaces where families can meet and communicate, and they also become a family in themselves. So this is a really cute story. This is a bunch of girls who had two of them met at one of the camps, and then they found each other online through TikToks, and they were all cancer patients, teenagers. And we heard of this group through one of them, and we realized they had never met. They came from all over the country, and they really liked each other, followed each other, talked all the time, but they hadn't met. And so through Aladina, we organized a weekend where they could be together. We got them tickets to a musical, fun restaurant, beauty session, and they had the best. It was so moving to see them connect for a weekend in person. And unfortunately, one of them passed away last year, and the fact that they had been able to spend this time together made a huge impact in the rest of the group. Okay, so this is the environment. Environment is key, as I mentioned. Incorporating elements of play into the spaces where the children are. This one in the middle looks very small, it's nothing, but this is the waiting room in one of the pediatric ICUs in a hospital. So what happened was I went to this ICU because we were going to do a big renovation project, and you know what I saw? I saw this family with a beach chair. Because the chairs that existed were pretty much like at a 90-degree angle, very uncomfortable. And so this family who'd spent a long time were in a beach chair, and I sat down and talked to them. It's like, why? And it's like, well, my back is killing me. I don't want to move. This is the ICU. My grandson's here. And so we decided we needed to create a space where they had this comfortable armchairs that can go back as if they were in a first-class plane, and just a little space for them to recharge. Never underestimate the power of sleep. Taking care of the basic needs of the caretaker is essential. And this is a great example of, this is the pediatric palliative care unit in a hospital in Madrid. And we brought the garden to them. And so where you see those tables and chairs are doors, and the beds can roll out to the terrace, and the patients can spend their time in nature even whilst on the bed. Okay, sorry, I'm very late. Now, this is a survivor story. This is Andrea, a very good friend of ours. She came to us as a patient. This is an example of what happens with survivors. I can't tell you how many operations later. I'm telling you, it's about 17 operations later. She has decided, she made the hard decision to amputate her leg because she really couldn't take it anymore. And now, as a young adult, she continues to face a lot of difficulties and is not finding exactly the support that she feels she needs. There's legal matters, and then there's emotional and psychological matters, and we have an obligation to continue to support them. Now, this we have discussed. These are just some very rough numbers on what Aladina can do in a year. So these are numbers of sessions, just to give you an idea how we can impact on all the things we do. I can share the presentation if anyone is interested. And so, just to sum it up, these are things that clearly work. Presence, real relationships. These, okay, can I have 1 more minute to finish? I promise. These are people, relationships, people in a very vulnerable state. You can go up to a very young child and play if you don't know them, maybe, not a teenager. Unless you build a relationship, there's no way this is going to be effective. And the same goes for families. You need professional team. Even volunteers supervised by a professional team. You need a complete family approach. It's essential. And you need to think about post-treatment care. And scalability. If something works, we started tiny, it can be scaled up. Well, this is innovations, and all I want to say is expanding life. Now, just to say goodbye to you, this is our newest project. This is the future. This is something that I truly believe is going to change the way we treat childhood cancer, and what I am currently dedicating a lot of time to, because I have to raise 15 million euros to achieve this. But we are going to be building the first day center for children with cancer in Spain. So in places where there's a high density of population or many hospitals, you know, during hospitalization, all of the services that we've just discussed take place in the hospital. But what happens when you're not hospitalized, where the child is not hospitalized? And, you know, more and more, they want to kick you out of the hospital, obviously, and send you home. But if you're home, you're very isolated and you don't have access to any of these services. You don't have a psychologist, you don't have play therapies, you don't get access to the dogs or to sports. So we are building a house. Nobody will sleep there. It's just a day center. But it will host all the services that any patient and family might ever dream of. So it's going to have a huge garden, it's going to have a pool, an indoor pool for rehabilitation, a gym, arts, movie, theater, anything and everything. Once it's built, you will all be invited to take a tour. And I think it's also going to be essential for survivors and for parents who lose their children. We are devoting a building just for parents who have lost their children, whom we continue to treat afterwards. And this is it. I just want to end by saying thank you. And, you know, children are children and they deserve to live, and we deserve to give them the best possible childhood because it's an essential right. And so this is a cause that's very, very dear to my heart, and I believe that medicine needs to be humane, and if we work together to encompass what being a child or what being a person truly means, we will be much better at curing this disease and getting the best possible outcomes. Thank you very much.